Hello and welcome to the Go Ellsworth Show. We're so happy that you've joined us. Today, I am here at Ellsworth County Medical Center and happy to be in Mr. Andrew Bair's office. He's this, what are you?
The CEO.
You are the CEO, the Chief Executive Officer of Ellsworth County Medical Center. And I'm so happy to be here. Thanks for having me today.
Well, welcome.
Thank you. So I was just asking you, how long have you been here? It seems like you haven't been in Ellsworth very long, but
No.
you've already been here since?
Since October the 8th, so over 10 months.
It's just amazing.
Yeah.
I feel like you've integrated so well into our communities already, and you've done so much, and you were telling me you feel like you're moving in slow motion.
Yeah, there's always a lot of work to do.
Sure.
And there's more to do, and that's good.
Yeah.
And this is a good group to do it with.
Yeah.
So.
Well, we're really thankful for you and your wife being in the community.
Yeah, we love this community.
I'm so
it's
glad.
fantastic.
Yeah,
So.
that's really great. Let's just dive right in because I have lots of great questions to ask because
Okay.
there's so many wonderful things happening here at our wonderful hospital. And this an amazing facility that we have here, and we're so thankful to have such a wonderful facility here. So tell me a little bit about, let's just start with, I mean, I know that rural hospitals and the rural health needs is a huge issue, and there's lots that can be done or lots that needs to be done. So let's talk a little bit about those needs in the rural areas.
Rural healthcare is a real challenge. In some parts of this nation, there are what they call healthcare deserts, where small facilities have actually closed, leaving communities without health care for sometimes hundreds of miles. Now, that's not where we're at here,
Yes.
but we are in Kansas that has 80 plus critical access hospitals, more than any other state in the nation.
Wow.
And so some of our colleagues out west from here may be at risk. So I'm very, very interested in how we deal with rural health as a nation and as a state. Like I said, we're not in that kind of situation. We're a little bit bigger than some of those communities. We think of our community as being just a small community,
Right.
and yet there are some that are much smaller that struggle with, I would say, declining populations, and then that creates what we call payer mix. So if you have a high Medicare, Medicaid payer mix, that leaves you in a very difficult bind as far as trying to keep afloat.
Right.
With managing. However, here, our payer mix is good. We have good commercial industry here in town, and that keeps us pretty okay. I would say it's always a trick. It takes a lot of money to run a hospital. We get a lot of revenue. We're over $20 million that we receive every year, and it takes just about that much to make the place run.
Wow.
So it's a lot.
Yeah.
Here we just recently did a community health needs assessment. I got to refer to my notes here. So
Check those notes.
yeah, check them. So you were part of this, and
Yeah,
we
I
invited
was.
many people from the community that identified 8 needs. One of them, top one, was provider access. That's, can you get in to see your nurse practitioner or physician in an appropriate amount of time?
Right.
We struggle with not having maybe enough. So we just recently signed on Ryan Leahy. We're really excited about that. He's a new PA, and we think he's going to do a dynamite job here. So he has yet to get, he's got his license all squared away, but now he's got to go through all the credentialing for different insurances. But as soon as he's through that, we're going to be marketing this guy a lot. Mental health, that's always a challenge.
Yes.
Nationally, we hear about the struggles of mental health, and we're no different.
Right.
And so we're going to be working with Central Kansas Mental Health and Mosaic, and they're going to help us lead the charge on that. Social work services, we just hired and offered a social worker a job here, and she should be able to help us with, I would say, what we call our, what do we call it? Our patients that have comorbidities, that's one of those medical things. So
Yes.
they're sick in more than one way,
Right.
or more of our challenging patients,
Okay.
helping them navigate the healthcare system. So quite often if you have specialty care, and you're not feeling well, it just becomes onerous. And just have someone to hold their hand through all those appointments
Yes.
is, we think that's a real
It is.
real
That
important
is
service.
so vital.
Yeah,
Just living through that, with my own parents, it's
Absolutely.
so hard to navigate.
it is.
So
And
if you
so-
can, and take that onus off of your nurses who are now doing that work, basically, right? Or
Yeah.
trying to learn it and do it.
Absolutely.
So having that social worker will be
And I am so
vital.
sorry. I forget the name of the service, and I'm going to get shot for forgetting it. But in the middle, I'll remember.
Okay.
I'm fairly certain.
all right.
Affordable wellness centers. I know that we have a wellness center or a gym opening up here in town here shortly. But not everybody can afford that, and what do we do for that? And I think who's helping us lead that out? Actually, you and economic development. But the hospital here actually has a physical therapy department that we open to the community for a fee, and we're talking about how it is we can actually lower the price of that as well. Substance abuse. We all heard about how that's a national challenge. So we're taking a look at how we deal with that in the community. And I think also the Kansas Health Center and Central Kansas Foundation will help us with that. Additionally, health insurance. I think our focus here at the hospital is actually to spend a little bit more of our resources on what we call insurance navigation and then financial counseling to help people. It costs a lot of money to come to hospitals,
Yes.
and it's hard. And we'd give it to free for anybody if we could make it work, but we can't.
Right.
Like you said, $20 million of revenue coming in, and that just barely covers what it is we do. So we'll be working with those ways of doing it. Just awareness of what it is we do in healthcare.
Right.
I think our marketing department is going to be working with the health department to make sure that we all know what's available to us here. That's really important. We have a lot of services here, and quite often people say, I didn't know we had that.
Right.
I didn't know you did that here. And finally, our ambulances services. We work with the county. We've got good staff of paramedics and EMTs,
Yes.
and yet sometimes there's not quite enough to meet the needs of the community. So we're working on alternative methods of making sure patients can be transferred from here to other facilities. Not that we had put them in another car, but how it is that our staff can join in with their staff and make that a smooth transition so that you can get to where you need to be. Our ER is fully staffed. We do what we call, actually, what do we call it? We call it treat and stabilize and transfer. So we deal with everything, but we don't have an intensive care. We don't have an OR.
Sure.
Those things cost too much money for a hospital this size.
Right.
But we are just 40 minutes away from all those services, so we can get you there pretty quick if we
Right.
can get you in the back of an ambulance, and
Sure.
we're doing everything we can to make sure that happens. So that's the community health needs assessment.
So one of the things that is so great about this particular format and this particular way that we can do things is let's talk about some of those services,
Yeah.
okay? One of the things that you talked about this morning at our coffee chat was telemedicine.
Yeah, so we do have telemedicine. That's something we're taking a look at and how it is that we can improve. So just be looking for of ways that we can use this important service. We have a examination room where there's a camera and there's a large screen TV where you can actually have dialogue with a physician anywhere. And so we go through the process of credentialing those physicians and making sure that they have what they need on their end, but you don't have to leave town to see a physician. We've had many appointments here with a physician in Wichita right here in our clinic.
Wow.
Yeah.
That's just amazing to me. And so you just make that partnership with any physician and
Yeah.
and then that appointment just happens.
Yeah.
You
yeah.
were mentioning like dermatology, for example.
Yeah, we actually have a little camera that they put right up your skin, and actually it magnifies that, so the provider on the other side, the physician on the other side, can actually see your skin better than what I can just looking at your arm here. So
That's just amazing.
yeah, it's great.
So the clinic too has some new offerings that I wanted to talk about. For example, let's talk about the pain clinic a little bit. That's a fairly new service.
It is. So in our outpatient clinic, okay, and I want to be certain that people know. So our outpatient clinic is that area that's at the hospital. Just as you enter the hospital, there's a clinic area there for visiting physicians to come in. And we have some providers that have joined our staff that do pain specialty. What this is non-narcotics pain intervention, where they provide different kinds of injections under what we call fluoroscopy. Most people don't know what fluoroscopy is, but it's like an X-ray, only it's real-time moving. So they can see the inside of you and what's happening. So when they put that needle in, they can actually see it go into like the area near the spine where they need to inject. They can see that happen real time.
Wow.
They don't have to guess. They know exactly where they're at. And they've had a lot of success with helping people with chronic pain. And this is really important as we take a look at trying to get people off of narcotics.
Right.
Narcotics are great to a point, but then you start building up what they call not resistance, but you get used to it, and you need more and more to stay well, and then it has other harmful effects to your body.
Sure.
So this is a much better way to go.
Perfect. So in considering that outpatient clinic and providers that come in also, there's all kinds of those, right? We have gynecology.
No, we don't. So
no more gynecology.
But we have gastroenterology. So Dr. Johnson comes over and he actually does endoscopy procedures.
Yes.
Katie McWilliams does some wound care out of there for people that have just got some old festering wounds sometimes. When you have diabetes or some other medical problems, sometimes those wounds just don't heal quite so well. So we provide that right here. You don't have to travel. You can just come right here.
Great partnership with Hutchinson.
We do.
Right?
We do.
Dr. Hagley.
Yep.
Does he come?
Absolutely. So all good. And we're looking for other partnerships as well. So we'll be growing that area of the hospital. We think that we're always looking for what the community need is so that we can keep our care right here at home. You don't have to travel so far.
Yes. So, sorry, Dr. Hagley is cardiologist.
Yes.
Correct. So, okay. And what else do you offer out of there?
What else do we offer out of there? People come in for all kinds of IV intervention. People come in for oncology, so if they're on cancer fighting drugs, sometimes we provide that there as well.
Perfect. Audiology?
Yes.
Right? Doesn't he come once in a while? I can't remember his name.
That's not going to be part of that.
Yes.
So we do a lot there.
You can tell that I take advantage of some of those things because I know more than you do. At the moment.
You do. You've seen the audiologist?
Yes.
Okay. All right. You make rounds more. Also at this hospital, you'd be surprised at the technology that we have.
Right. So let's talk about that technology in radiology.
It's spectacular. It is very, very good. We got brand new equipment for just standard X-ray to ultrasound. All of that's brand new.
Wow.
Additionally, our CT scan is much higher level than what you'd expect in a small hospital. It's a 84 slice CT scanner, and then we provide some services with mammography. The mammography truck that comes by, they do 3D, which is just a spectacular diagnostic machine, and then we provide MRIs here as well. So we got pretty much a full service radiology department.
Right.
Additionally, our lab has some very, very up-to-date equipment as well.
Yeah, so let's talk about that. So we don't just draw blood at the lab.
No,
There's
we don't.
lots of other things that can happen.
So there are. We have something called a biofire that actually can turn around what we call microbiology. Remember, did you ever take microbiology or do any culture growing in school, like in high school, where
Yes,
you take
so
the
we
little
did grow the
plate
cultures, yes.
and then you put it away for a couple days and you look at it under the microscope.
Yeah.
We have a machine that'll turn those things around in less than 2 hours.
Oh my goodness.
So you can actually, what generally happens if someone comes in with an infection is they get prescribed an antibiotic that's a broad spectrum antibiotic. It kills a lot of different bugs. And then you get your sensitivity back 3 days later and you find, well, this is a better antibiotic for what's going on with them.
Wow.
And so you get prescribed another drug. What this does is you don't get that broad spectrum. You get something that's very specific for that.
From the get-go, right
the
away.
get-go.
Wow.
Yeah. So I didn't even know this thing existed until I got here. So
Yeah.
it's
I'm
very,
sure
very-
technology continues in that regard where
Yeah.
it's hard to keep up with all
It
of the
is.
new technology and everything that is new, and to keep up with it all would be
So none of this is my fault. Whoever was here before and the crew that's here have taken very good care of keeping this hospital up to date with this diagnostic equipment. It's very, very good.
we are so fortunate in all of those things. All right, so when we're discussing your employees and all the great things that they do, let's talk a little bit about employees here. Are you still running short? How's the staff working at this point?
So we do have some shortages, and it's not unusual for hospitals. We have a national shortage in people working in healthcare, and we think it might not get better anytime soon. So we're short of nurses. We need some people working as medical laboratory techs, and we need a physician as well. So, and another what we call what do we call them? Either a PA or a nurse practitioner.
Right.
So we could use another one of those.
Sure.
Our staff here, though, are incredible.
Yeah, and the retention is amazing.
It is.
I mean, you look at Dr. Whitmer and Dr. Slomka, and those. I mean, they've been here
For a very long
a
time.
very long time.
And we're very blessed with the people we have. It's unusual that that physicians are not only so good at what they do, but they're actually very, very nice people. And that's a terrible thing to say about the industry, but it is such high stress
Right.
that
Sure.
people do get kind of grumpy sometimes. And I don't think we have a problem here at all. In fact, these people genuinely care for each other, and they care for their community, and it really shows in everything they do.
Yeah.
That's one of the things that I talk to this crew about is how it is we care for the community, because we have the honor of caring for our neighbors and families and friends. And that's why things like privacy are so important. We want you to come to us,
Right.
and we want you to know that it's safe.
Yeah.
So we'll protect your privacy, and we feel bad if you'd want to go anywhere else for your care, because we care about you really and truly.
Yeah. You can just feel that, I think, when you walk in
I think so too.
from the front desk.
And I talk to
the
the crew
back.
about it all the time. Yeah.
It's a beautiful thing.
Uh-huh.
It really is.
Not all places are like that. So I think that we've got a really, really good crew here.
Yeah. So you've had a couple of kind of more executive
Yeah.
positions to fill as well.
Yeah, we lost our Preston here
Yes.
a while back, and so we're really excited that we've been able to hire a gentleman from Indiana. So he'll be coming here at the end of September. Steve Burkhouse
Very
as
good.
a chief financial officer, and then a gentleman from the Kansas City area is coming on as our IT director. His name is Charles Sokin, and he actually has family in Lorain and Holyrood, and
Yes.
has cousins out there. So
Perfect.
yeah, he's going to be a really good fit. So we're really excited about that, even though we're very sad to see some of our
Sure.
other people go.
Sure.
But we think we're sitting pretty good for the future.
Very good. It's just wonderful. Let's talk just briefly about your cafeteria. I just spoke with somebody at the Good Samaritan Center who said that her mom was just in the hospital and she loved the food.
Yeah.
And I can attest to that too, because my own daddy loves to come here and eat the food. He comes for breakfast and lunch almost daily. Those girls in the cafeteria, and maybe guys too, take good care of their patients and the people from the public that come in.
Well, they take good care of us too.
Yeah.
They really do. They're dynamite. I'm constantly amazed at some of the work groups we have. And you talk about tenured employees.
Yeah.
Those people have worked together for a long time too. We have a couple newcomers, but there's some that have worked back there together for a very long time.
Yeah. And they care about, they care about everybody. If they don't see my dad, for example, they're calling me to make sure he's okay.
Isn't that something?
Yeah, that's what a small community is all about, for sure.
Yeah.
I love that with all my heart.
Yep.
So that's just a beautiful thing to see as well.
It is, and I'm equally as impressed with our environmental services crew. This is a very clean hospital.
Yes, it is.
It's like the old days. All hospitals used to be spotless, but
Yes.
That's not the case anymore.
Right.
So they take really good care of this place. We're really proud of them.
Yeah, very good. What else do you want to talk about, Andrew?
Well, you talked a little bit about nutritional services.
Yes.
I think that some of the other services we provide is physical therapy and occupational therapy.
Yes.
Those are really good. But also, we have our own Sherry Johnson here that does nutritional services on outpatient as well.
Yes, let's talk
So
about
she does
that.
some nutritional assessments and help people manage their diabetes or just help them lose weight in ways that is not fad diets, but just
Which is
just managing their lives.
so important.
Yeah.
There's so much misinformation out there, but it's important.
Additionally, our respiratory therapist department, they have the Breathe Easy program where they have harmonica sessions with people that have some breathing issues, and it actually helps them develop their lungs and increase their capacity. So we've got some good stuff going on here.
Yeah, it's very good. I do try to keep all that, especially those recurring things, the Better Breathers Club and that stuff on my website too. So it's really good.
I'm sure I've forgotten something somewhere.
So it's okay. You've got a lot going on. There's a lot to keep track of, but I'd say you're just doing an awesome job. The last thing I'd really like to talk about is one thing that's near and dear to my heart, and that is you were an integral part of the Christmas store last year with your teams going out and shopping. And I mean, it was like a scavenger hunt, but yet it was such a beautiful thing and helped the kids at the Christmas store. And then you did a work day, right?
Yeah.
Did you go to where you went to the Historical Society?
Yeah, we went to
and somewhere else, didn't you? Family Connections.
Yes.
Right?
Yeah.
So, I mean, just the things like that you're doing, and I'm hoping that, I know we'll see more of that. So
you will.
We have an idea for you in the fall, actually. So.
Okay, fabulous. I want to hear it because it's really, really important for us to get out there and see the community in the community as well.
Yeah. So that's a really great thing too. So thanks so much for having me today. Thanks for all you do, not just within these walls, but obviously also outside in the community. I think getting your team out there to be part of the community, and maybe not forcing them into that, but just getting them out to become part of the community. And when people feel like they're part of a community, it helps them to stay to be part of that community.
Yeah.
So I think
Absolutely.
that's a big deal too.
Well, thank you.
So thanks so much for having me.
We really are welcome.
We really appreciate you and all that you do.
Thank you.
Have a great day.
You too.
Thanks everybody for watching.